I think it's both a whole orientation on a housing sector. First of all, orientation to a thinking and the practices, new practices also, where you can see several very good benefits if you organize for the needy people, but also I think for households which have a home at the moment but have very high costs or something else. It's a way of putting a basement for the whole life through the housing. It is in that sense a crucial one. But it's also a question of that you can develop through the housing first, the housing right thinking, because there we have a basic social and human basic rights in Europe and the international level, but there is always been a problematic to ensure the resources to, in fact, how to get a livable the housing right for different groups. So this could be this housing first thinking, one way to that thinking, to that way of working. It's kind of a step to a guarantee of an affordable house or apartment for your life. So housing first absolutely is not housing only, and it has been said from a different perspective that you need the individual analyzed, evaluated support services to succeed in housing. So this is about the whole orientation. Then there's many details which are developing inside the housing first thinking and different applications. But this could be some of the main elements in the housing first concept. Well, it works in the way that, for example, in our country, that you or the cities which have now taken it into more concretely into implemented it. It means that you make a tenancy. It's a legal basis for it. You make a tenancy as a permanent tenancy which secures a permanent housing. You control the living space which you have. It's for your independent use. So that's the legal side of it and the actual side of it. But then it also means that you are entitled to, according to a plan which you make with the support service authorities or third sector or housing or some other service provider, you make an analysis on what you need. It can mean medicine help for medicines, it can be help on income support, it can be help on social services, all the possible things which you perhaps need is combined to your daily life. So it helps your daily organizing it. It can be also a question of that you are able in a way to manage your own things on daily basis. And there's lots of people which are not capable, or their rhythm is in a way, in a daily sense, a way that doesn't help their readiness to cope with housing or with employment and work and other things. So it's a large package of things which you have to make an individual-based discussion and a common plan. You can take as a common target the housing-led or housing-first thinking in your implementation of a national strategy or a city-based strategy or a smaller, even local strategy. There's no limits on this kind of, because it's a choice which you can make if you have the resources and if you have the thinking here behind. So implementation which is on the public level, different public levels, and also the EU level. It could be in the EU Homelessness Strategy, which we hope to develop in the future. It's part of that also. But then it's in implementing it, you can use also the basic principle of housing first, and then you can be a provider which from third sector, the NGO associations or foundations. It can be a social enterprise. It can be a totally private firm which would take care of new kind of housing units, and they develop and work with the housing first as their basic idea. The Finnish plan is that we have had, I would say that the background is that very long, from 1980s already, there's been more and more part of the welfare thinking, a welfare policy, and the services. They have had their, in a way, thinking that housing as such is a crucial element. But that was meant a combination which meant in many cases also a staircase model, that it's a reward to get an apartment after you are sober and you clear your head without the mental problems. Then you can get it. That you're ready for a house, then you can get it. And to change where I would say it's inside 10 years, and it's been especially Helsinki Diakonia Institute which started it with a very chronic, problematic group, one of the most sick groups, and with several mental and other problems and illness, and they started it, and now they have already about 10 years experience working with a group which is elderly people with severe problems. Dual diagnosis they can have, etc. And it works. It has been a very good. They don't lose although they start drinking after a period, they don't lose the house, their apartment. They can come back after a rehabilitation somewhere else. Or if you're in a jail, you can keep the house, the apartment. And this kind of thinking was already inside. Now we're spreading it, the idea also for younger persons, for women, the project, we hope also for new immigrant homelessness families. They are increasing now in Finland, and with all of these you could develop an application which follows the housing first principle. Absolutely, it is. It's amazing how strong it is, and we can see, as we can see, also the European projects already, which are now developing, and the pathways to housing in New York. All these tells the same, that the retention rate is quite high. You keep the house, your apartment. You have same experiences. For example, in Tampere, where we had a 22-unit apartment, and with quite heavy users in alcohol, and users of hospital care and other welfare services. And when they moved to a new unit with a team of good social workers and nurses, absolute good results. And it's more and more or less, it becomes other things important. How to keep how to cope with your rent, how can you manage your daily economy and your life. These become the more important things. And so it shows good results. But then it's also the question that it's in the beginning, I think, at the moment. We have to get experiences of different groups, and then we have built places where in a single site there is several in the same situation of persons in their individual housing first flats, and this is an interesting now test. Is this kind of also housing type one possibility for certain groups that want to live together with their peer persons? And the combination now and the cooperation between the more scattered way of organizing housing first, and in more the single site, the cooperation between the personal and the support teams, all these are now elements in the future work which we are doing. In 2008, when we started, there was about 80 projects concerning new buildings, renovation, acquisition of flats from the market, and moving them and transferring them to rental housing. And in most of them there is the support element and there is development work, and gradually all of them are taking into practice, they will implementing housing first thinking. So it's spreading, becoming deeper, we hope, and also that it affects the training content which is needed for the personnel. The funding is one of the very important element in the Finnish housing strategy for homelessness. It's been from the start. It comes from the National Housing Fund, which has given the main investment funding, grants and loan, which covers 100% of all new investments and renovation done. So it has been, as a whole, we have used for this sector about 190 million euros during now 5 years from the National Housing Fund. Then it's the Ministry of Social and Health Care, which is giving the funding, 50% funding for the new personnel, the new staff which is hired in the new units. There's about 200 new persons have been hired for the clients, for the work with the homeless persons directly, which have been previous homeless persons that they cope. So this is one part of the funding for the program, and then the last part comes directly from the municipalities, their share of the new staff and the services. My feeling is that we are in a very positive situation. There is a discussion ongoing that we're not going to build any more of these bigger units. We made a decision clearly, and now we have to go into a more scattered, centered way. But at the moment also you have to take care that they have to be cost-effective units as a whole. Otherwise there is the increasing political pressure on how to manage with the state debt, which is increasing through different welfare programs. So we are not outside it, and that's I would say one of the challenges after this program then ends and the new is under planning from 2016.